Live from 42nd and 2nd. This is New York's very own PIX 11 Morning News.
All right, coming up at 8:30, everybody, we are live with a doctor who survived COVID-19.
Yeah, he's weighing in on how the disease could impact the president following his overnight announcement that he has tested positive.
Back to continuing breaking news coverage that we're following after President Trump tweeted that he and the First Lady tested positive for COVID-19.
Yeah, he made the announcement just before 1 o'clock this morning, just hours after holding a fundraiser in Bedminster, New Jersey, and hours after one of the president's top aides, WPIX, tested positive.
We spend a lot of time with Hope and others, so we'll see what happens. She tested positive. She's a hard worker, a lot of masks. She wears masks a lot.
The physician to the president says he learned about the positive results last night and says the president and First Lady are both doing well and plan to stay at home.
Well, this morning, many Americans can't help but recall the many times the president seemingly downplayed the virus and the importance of masks as well as social distancing. Some medical experts say they saw this coming.
It's obviously unsettling, but I'm not surprised given the contagiousness of this virus and what have been the lax protocols.
The number of people that could potentially be exposed and at risk of contracting this virus is significant here.
No word yet on any symptoms the first couple may be experiencing. The president has canceled all of his upcoming events.
Well, President Trump does fall into a high-risk category because of his age and his weight.
Joining us with more insight right now is Dr. Jake Deutsch, COVID survivor and co-founder of Cure Urgent Care Center. So good morning to you, doctor. How you doing?
Good morning. Good. I'm good. Thank you.
So this is big news right now, and of course all eyes are focused on the president. He is 74 years old, right? He is in that vulnerable age population. What were your thoughts when you first heard this news, knowing what you know about the president's health?
Certainly I was shocked, but not surprised. The important point about wearing masks is so critical, and he's not really been a big supporter of that. So here's proof that not wearing a mask is going to potentially get you exposed to COVID, and he tested positive. So my concerns are going to be that he could have complications, and I would suspect that he's in the asymptomatic phase. He may not have actually started to mount symptoms, but I'd be very worried that he could have complications like respiratory illness, severe issues with the typical type of complications that become more pronounced. Obviously, this is something that everybody should be watching closely. It affects everybody that was in close contact. And, what are we going to be doing to trace those around him who are potentially sick?
And Dr. Deutsch, that's what I want to ask you about, because we saw him on stage with Joe Biden on Tuesday. They took a coronavirus test, and then he was in Bedminster, New Jersey last night. Question is, though, how long is it in your system before you will test positive for it? Do we know that?
We don't know that, but what we do really understand is that you could have 2 days of being basically asymptomatic, where the virus is starting to replicate, but you're not showing symptoms.
So he could have had it on stage with Joe Biden, if that's the case?
Absolutely. And, that's really the most striking point, when he's talking about Biden wearing a mask and, being overly cautious. He could have, in fact, had COVID and be putting other people at risk. I just think that the testing is so critical, and when rapid tests are being used, they're not as accurate. They don't really want to understand what that protocol looks, and it just shows that the protocol hasn't been in place that's even protecting the president of the United States.
If you are asymptomatic, right, could you develop symptoms down the line in that 14-day window?
Right. So the traditional symptoms are going to develop in the first 3 days, where you're going to have cough and maybe sore throat, body aches, and fevers. But what I always am critically watching is the 7-day window. Many people who have moderate illness at 7 days turn the corner for the worse. So we have about a week that we need to really be following this story and understanding what this means to the president of the United States.
Absolutely. And this is such a wake-up call for all of us, right? And especially as we head into flu season and this possible second wave. How worrisome are you of that second wave?
Well, what's interesting is we are seeing a very low level of positives in New York, less than 1%. We're testing thousands of patients in our practice, and we're following the same numbers. And of the people who are positive, we're seeing very low illness in terms of severity, and many are asymptomatic. So, one thing that is encouraging is that illness seems to be less severe, and hopefully that would be the case for the president. However, we are very concerned that those numbers are going up. Back to school, back to work, question about wearing masks. It just, those numbers are going to go up. We need to just understand what that means for the severity of the illness.
Well, yeah, in certain parts of New York, we've seen a 12% infection rate in certain areas of Brooklyn. There's these clusters that we're closely following as well. But this is a good reminder, besides mask wearing and if you feel symptoms, to get tested, but also to get the flu shot. Have you seen this year more than past people getting their flu shots?
Yes. Yeah, a tremendous increase in need and request for vaccination for the flu, which I think is terrific. People are really listening to that recommendation. Eliminating the flu, having less concern about any illness that looks like COVID is 100% of what we're trying to avoid. So I'm very, very happy to see that people are getting vaccinated. And I think that it'll be a different flu season in the sense that we're going to be experiencing the flu season with the majority of people wearing masks. So it may be a much less severe flu illness that we're going to see, a much less in numbers, and just the common cold as well. But here lies the point. The president of the United States got COVID, and the reason why is there wasn't mask wearing. There was very clear connection here, and I think that that's the point that everybody should take home. You are not immune. Everybody has the same risk, and we need to use these levels of precaution.
Absolutely. Keep that mask on. We know it can be, no one wants to do it. It's tough. It's not exactly comfortable, but...
I want to let you know, I had COVID. I still have my antibodies, but I wear a mask. And part of that is to, make other people understand how important it is to protect other people. I don't think that I have anything to be worried about, but we could never be too cautious. So we all have to do our part.
You know what?
No matter what your sense is, who you are, what your level of position is, where you live, it doesn't matter. We all need to recognize this important part, and we need to demonstrate unitarity and everybody on the same page.
I know we're out of time, but you brought up a very good point there. You still have the antibodies in your system, and I think people say, oh, well, I had it and I have the antibodies, but it's still unknown and unclear how long you have the antibodies for and what they exactly do for you.
You can still get it again, right?
Well, there haven't been cases of reinfection, but it's about sending a message to people how important this is. People walking down the street don't know that you've had it, and then they might think that applies to them. I don't need to wear a mask, and you potentially could be spreading colds, you could be spreading flu. So all of that needs to be minimized, and wearing a mask is going to work. I'm going to put mine back on. I'm going to go back to work seeing patients, and I hope that everybody takes that message with them.
All right, doctor, thank you so much, and I just want to say that no cases of reinfection in the U.S., but there was that one case in Asia that we reported of a possible reinfection. All right, doctor, thank you.
That's right. Wear that mask, Dr. Deutsch. Glad you're feeling better, and thank you for your time this morning.
And we'll be tracking the latest on...